We get this question a lot on social media. Can you tell us the status of vaccinated versus unvaccinated in cases and how we calculate that?
Certainly. So this is the question that comes up a lot, and the question is, among the cases that are in 1 day or cases that are currently active, how many of those individuals are vaccinated and how many of those are unvaccinated? And in order to answer that, in order to provide that measure, it's best to compare rates, and I'll explain what that means. So when you look at the population of individuals in KFL&A, there's approximately 165,000 people who are already fully immunized. So this is a fairly large group, and that group already gets that really excellent protection from the vaccine. We know the vaccine works really well and is around 90% effective. But what that means is that 10% of the individuals, even though they are fully immunized, only 10%, but it is a high number when you look at the overall 165,000. So 10% of those individuals would not have that full protection, and they could become cases. So then contrasted that to a group of approximately 43,000 of unvaccinated individuals in KFL region, and that also includes children who are not yet eligible to receive vaccine. That entire group of unvaccinated individuals is considered to be at risk for disease. Their vaccine effectiveness in this group is 0 because they have not received vaccine. And then from that group, you'll also see a number of cases on a daily basis. So take 1 day, for example, hypothetically. 1 day, we had 4 cases among the vaccinated group. And that same day, we also had 5 cases among the unvaccinated group. So that makes a total of 9 people who are sick. And when you look at that number alone, you say, oh, out of nine people, 4 of them are vaccinated, 5 are unvaccinated. This is a very, very misleading comparison because that does not truly reflect the risk that vaccinated versus unvaccinated have of contracting COVID.
Can you explain how we calculate that?
So the best way to express the difference in risk between those who are vaccinated in this group and those who are unvaccinated over here is actually to calculate a rate and do so over a longer period of time, for example, over a month. This is what we're doing here in KFL&A. And when we look at these rates, we are comparing the rate of those sick among the vaccinated individuals over the total number of vaccinated individuals. And then we do that same thing for number of sick unvaccinated and the total number of unvaccinated individuals. And we have these 2 very different rates. And when you look at this rate, we actually come up with the conclusion that you are at 5.5 times greater risk of COVID-19 if you are unvaccinated. And that's a much more meaningful figure because it truly reflects the level of risk that these individuals face versus those individuals who are fully immunized.